Coming to you from the whiteboard today. So just had a conversation with a patient who just came back for his second visit. So his first follow-up visit was in last week. He's a long distance runner with issues with hip tightness, has history of bilateral knee surgeries, also has a history of thoracic lumbar cervical spine issues from being a fighter pilot jammed into a cockpit of a F-18 for 11 years. So generally healthy, extremely intelligent. So a lot of stuff that I was able to cover with him on his initial visit as far as patient education. So when we were going through patient education, one of the questions I always ask patients is, what have you been trying to do for the problem that you're coming in for? So he'd already tried massage and physical therapy and chiropractic. And at home, he was using kind of a mismatch of the information that he got from those practitioners. So he was doing foam rolling and stretching and a little bit of rub down every once in a while, and wondering why he's doing all the things that he's supposed to be doing according to the other practitioners, but he's still having problems with tightness, stiffness, pain when he's running. So during patient education with him last time, I went through explaining when I put you in these positions, what I'm testing is one muscle's ability to contract to see if it can contract to stop me. I'm not trying to see how strong you are. I just want to know if the muscle can kick on. So as I'm going through that, and as he would say, wow, yeah, I can't stop you. I can't do that. I refacilitate, come back and retest the same test. And he'd be like, wow, that's crazy. The other crazy thing is when I would test things like hip rotation, and he would fail a neuromuscular facilitation test for gemellus or quad fem or piriformis, one of those deep hip rotators, and I would treat that and then come back. Not only did he stop me, but also his range of motion increased by 10 to 15%. So as I'm going through and educating him about this, I'm saying, okay, so notice how your range of motion is increasing, but I'm not doing anything to stretch you or massage the muscles to make them relax, or anything to push range of motion. All I'm doing is refacilitating normal contraction by facilitating normal neuromuscular function. And then guess what happens? When your muscles aren't stuck and guarded because they're inhibited, they start to contract and relax through a full range of motion, and you have a full range of motion. So, went through education with him and said, no more stretching, no more Theragun, no more rolling, no more massage. He's like, that's the stuff that I've been doing. And I said, that's why you're coming to see me. So he has some follow-up questions on that, and we got into some neuromuscular physiology. So fortunately, your smarter patients that want more information, you can go into more detail. So he did well with his home exercise program, did really well for 2 days with what we did. But then actually had to have a pacemaker put in on the third day because he's had a little bit of a heart issue. So now he's been down for 3 days because of the pacemaker. But he came in and said, even though I haven't done my exercises for 3 days because I was in the hospital getting the pacemaker, then in recovery, obviously didn't really have time to do my exercises, but I still feel like I'm maintaining the range of motion that we worked on, that we got last time. Had I used my previous thought process of stretch and roll and Theragun when things feel tight, I would have been doing that stuff like crazy now because I was in bed for basically 3 days, but I didn't get stiff again. So there is your take home. Aha, oh, this is the way we should be doing things, because the more people have to go back and treat their symptoms themselves at home with a roller, with K-tape, with massage, with stretching, with whatever, orthotics, braces, blah, 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 blah. The more they have to do that stuff, the more it's proving that what you're doing in the clinic isn't holding, isn't working, because you're actually violating physiology when you do those things in the clinic. Okay, so now let's get to today's visit with him. So started checking things out, and he was asking me more about stretching and rolling and those types of things. So he said, yeah, it's crazy that I don't feel tight like I did before, even though I'm not doing the things that would get rid of the tightness. And I said, well, here's the interesting thing. When I talk to elite athletes, when I have elite athletes as patients, and I ask them how they feel after they foam roll and stretch and do all those things, they say they feel loose. And when I ask them how they feel when we're done with the treatment, they say they feel stiff. Okay? So the goal always with any patient is they should always feel stiff, because stiff is responsive. So here's the analogy I gave this guy, and here's the analogy that I give people when I talk about this. So if I gave you the option, we're gonna drive up a windy mountain road, we're gonna race, and I'm gonna give you first pick of car, okay? You can either take a Ferrari or you can take a 1965 farm truck. Which one do you wanna race me in? So now most people would say, well, I wanna take the Ferrari. And I said, well, whoa, wait a second. Now, if this is somebody who likes to be loose, I would say, whoa, wait a second. You know, that Ferrari, it's really stiff. Like, if you turn the steering wheel that much, it's gonna turn that much. When you barely tap on the brake, it's gonna come to a stop. When you hit the gas, it's gonna take off. It's extremely responsive. Now, if you like to be loose, what you should pick is the 1965 farm truck, because you turn the wheel this much and it's still going straight. You can go down the road like this and you're still going straight. You jam on the brakes, you're gonna maybe slow down a little bit. You punch on the gas, and after a little bit, it'll start speeding up. So that's a loose situation. And realize if you're driving the loose car up the canyon, you might miss a turn because it didn't respond. With that Ferrari, it's extremely stiff and responsive. So whether we are dealing with athletes or everyday Joe, we want to be stiff. Now, we don't want to be tight. So if we were tight, that means we can't move the steering wheel. Like, we're going to just go down straight and we can't move anything. We can't push the brake because it won't respond. Okay, so that's the difference between these three things. So if I give people, general population people, before they come in here, even some athletes before they come in here, if I give you the option of which one of these things would you rather be, most people are going to choose loose because that's comfortable. It's comfortable to fly down the street and just be bopping, blah, 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 and you're just going straight. Until you have to swerve to meet another car, avoid hitting another car. And then you're loose and you can't do that. And you go smack dab right into the middle of it because you have no responsiveness. You have no stiffness, okay? So we should be stiff at all times. So when my elite athletes get off the table and they're like, man, I feel stiff. I say, you like that? Oh yeah, I like that. I feel like I can cut on a dime and I can do whatever. That's what your joints are supposed to feel like. So if you are functioning on normal neuromuscular function, you are stiff. You react quickly. You get in and out of positions and range of motion safely. If you are loose, you are grinding on connective tissue. You are putting too much stress on ligaments. You are pounding on meniscus and cartilage. That's what happens here. Here, same thing. If you're too tight, that joint doesn't move enough, you're just gonna grind down those connective tissues until there's nothing left, okay? So our goal is always to have patients be stiff. So when they get done with their warm up and cool down, when this patient, this fighter pilot guy got done with his warm up and cool down, I asked him, what did you feel like? Did you feel loose? No, I didn't feel loose. I felt loose when I got done foam rolling and I thought that felt good. But now that I know what it feels like to be stiff, I like stiff a lot better. So our goal is always to be stiff. So loose is dangerous. No control. This is what happens. This is what leads to ACL tears and ankle sprains and idiopathic low back pain that gradually turns into herniated discs. Too much motion, no control, no strength, flexibility, mobility. Okay? Then we get here, tight. That means we can't move. We can't function. So not only are we not very athletic and be able to use our body to its most competitive advantage, but we also can't avoid injury, okay? So if I've got somebody who's hypermobile, who stretches a lot, think dancer, gymnast, the injuries they're going to have are going to be connective tissue, torn ACLs, torn lateral ankle ligaments, those type of things from hypermobility. That's what you're gonna get with stretching and mobility work. If we have somebody and we say, okay, no more stretching, no more foam rolling, no more mobility work, we're gonna get rid of flexibility, but we don't give them something else to maximize neuromuscular function, then we end up with somebody who's tight. What injuries do we have with people that are tight? Pulled muscles, pulled hamstrings. So if I had the choice, if I could only choose loose or tight, stretch and do all the crap that people do, foam rolling, massage to get loose, or do nothing and go out there cold, I would actually rather do this because I'd rather tear my hamstring than tear my ACL. But I really don't want to do either. What I want to do is be stiff. So stiff is motion plus strength plus stability, which is mostrability. So that's our course on mostrability. That's how we teach people how to maximize stiffness through exercise, through proper warm-up and cool-down, through functional screens, so we know what our patients look like before we start treating them. Isn't that a great idea? Okay? So here's the point of this conversation with this guy. We traded loose for stiff, and now he's happy, and we only have to work on stiff every once in a while because we're maximizing neuromuscular function. If you're working on being loose, you have to do this all the time because you have to keep on breaking yourself down to make yourself relax, to finally give in and be loose and unsafe. Now, this doesn't take any effort. Sit around all day, don't do anything. You'll get really tight, okay? So most physical therapists, chiropractors, massage therapists, athletic trainers are trying to get people here with things like mobility wad crap and stretching and foam rolling and Theragun and all the stuff I keep talking about. When you stop doing that, so think about what the physiological implications of those treatment strategies are. How are you increasing range of motion, passive range of motion? How are you increasing flexibility? Because you're decreasing strength and stability, which gives you loose. So the more you break down that neuromuscular junction, the more you cause inhibition, the more you cause muscles to relax, the more you force range of motion to open up without control, the looser you get, your performance decreases, your risk of injury increases. What we want to do is work on motion strength and stability, which is mostrability. How do we do that? We maximize neuromuscular function in the clinic. Then when we give them things to go home with, we're helping them maximize neuromuscular function at home through their isometrics. Then we're maximizing full range of motion. So people say, well, I won't be able to get in the splits anymore. Oh yeah, you will. You'll just be able to get out of the splits. So the important thing is getting into the range of motion and getting out of the range of motion. When you work on being loose and you force range of motion with splits and flexibility, you're getting into the range of motion without the ability to get out of the range of motion, which is why things break down, which is why you put too much pressure on ligaments and connective tissue and meniscus, that kind of stuff, okay? Here, we're making that neuromuscular junction sensitive so it is stiff and responsive. When you get into the end range of motion, you can unload and explode into the shorter range of motion because we have stiffness through the muscle, which means we have normal neuromuscular function, okay? So this doesn't mean you lose range of motion. This means you get more range of motion and you get out of the range of motion, which is what we should be doing. Can get into the range of motion, can't get out of the range of motion, can't get in the range of motion to begin with, can get in the full range of motion and get out of the range of motion. So when you're treating your patients or working with your athletes, ask yourself, which one of these things are you working towards and which one should you always be working towards? Your physiology says stiff is safe, stiff is reactive, stiff is explosive, stiff is unloading after loading, stiff is maximizing athletic performance and decreasing athletic or any other type of injury. So think about that. Let me know if you have questions below. And remember, if you want to do this with your athletes, with your patients, and you're wondering how to do that, that product is Mostrability. I'll put the link in the comment below. So go get that because that's what that talks about. If you want to keep on doing this, stop following me. I'm never going to teach you how to do this, and I'm never going to teach you or condone doing this. So if you're on board with this, keep on watching, post your questions below.